appointment?
Yes.
Okay, so we're gonna take a look at your ear today. So was it this ear?
Yeah, the right ear.
Okay, so I'll just have a quick look before I take you through. So you've been experiencing some pain?
Yeah.
Okay. So I'm just making sure that we can go ahead and take a look, just checking that there's no trauma or active bleeding or anything. Otherwise we might have to send you to A&E, but it all looks good. And was it just this ear?
No, both actually.
Okay.
But this one's worse.
Okay, and have you had any recent falls or anything that you can remember?
No.
Perfect. Alright, so let me just check all your details. Okay, I think we've got everything for your consultation. So I'm just going to get the room ready and then I'll bring you through.
Thank you.
Okay. So what I'm going to do first is just have a look, okay? So I'm looking around the ear, down the neck, onto the shoulders, in front of the ear, down the jaw, behind the ear, just inside the ear, and then just straightening the head. We're just going to look at the other side. Okay, so you've been experiencing this for about 5 days or so?
Yeah.
Okay. Is it consistent or does it come and go?
It does get worse at times, but it is consistent.
Okay. And any headaches?
No.
Okay. I'm just going to pop some gloves on and then I'm just going to do some physical examining. Okay. So I'm now just going to feel around behind the ear. Down the neck. Along the shoulders. Along the back. Just comparing the two shoulders. Down the back of the neck. underneath the ears. Okay. Now, just before I touch your actual ear, is the pain coming from inside or along the outside of the ear?
It's more on the inside.
More the inside, okay. So I'm just going to touch the outside of the ear on both sides now, just so I can compare. Above, behind, and then what I'm going to do now is just scan the head, just to make sure we're not getting any residual pain from a different part of the head. Just going to feel on the front of the neck, just feeling the glands, and they're not swollen, which is good. Gland on this side is slightly larger, that could indicate an infection. Okay, I'm just going to feel down the arm. Down the back. Down the other arm. Okay. So I've just got your glasses here. So I'm just going to have you just pop those on so we can just see how they're sitting on the ears. Just to make sure that they're not causing any issues. Okay, you can go ahead and pop those off. Okay, I'm going to look more closely at your actual ear. So if you could pop the earrings off on this side, and then I'll start. So first of all, I'm going to start with some pressure points. Just let me know if anything does trigger, like a sharp pain or any tingling or any strange sensations. Hopefully it shouldn't. This is just more of a routine exam.
Okay.
I do feel like we are leaning more towards an ear infection, but I just want to make sure we've covered all areas first.
Okay.
So I'm just going to do some pressing around. Just going to go in. Just going to use slightly smaller pressure area. That feels okay.
Yeah.
Great. Just going to use a sterile swab just to test on the inner areas of the ear. Just pressing. And these are known points. Can sometimes attribute to other issues in the body if this is where the pain is originating from. But as I said, I'm pretty certain this is an infection, which is why you're feeling it on the other side as well a little bit, because if it's a deep infection it can affect the vestibular nerve. And all that feels okay?
Yeah.
Okay. Just going to do some very light touch now. You okay? And then even lighter. And all of that feels alright? Okay. Just using a sterile cotton bud now. I'm just going to press this onto the ear and just see if it's bringing back any pus or moisture. Okay, that looks good. And then just with another sterile swab, I'm just going to go slightly deeper. Just do a swab there. And then this will get sent off to the lab to check for infection. Okay. what I'm going to do is just take some measurements now. And then if you do come back, we can check these again and see if there's been any change, perhaps more swelling. That's 3.1, 2, 3, 4. Okay. That's 5 exactly. And then I'm just going to measure inside the ear to the outer. That's 1.123 Just going to check the other side on the measurements. I'm certain they'll be quite similar. Okay. Okay, perfect. I'm just going to do a little spray just to reset the senses. So a slight cold touch now. Okay, I'm just going to do a little test on your hearing now. Okay, so I'm just going to ask whether you can hear it on your right or your left. Okay.
Right. Right. Left.
Perfect. And now just say, let me know when the sound has stopped, so you can just say now. Okay, and then if you could let me know if the sound is moving away, so getting quieter or coming towards you, getting louder.
Louder. Quieter. Louder. Quieter.
Okay, and I'm now going to do some sounds in front or behind you, so just say in front or behind depending on where the sound is coming from.
Behind. In front. Behind. In front.
Perfect. Okay, I'm just going to have you turn your head. Just going to angle it slightly and I'm just going to take a look. Okay, there's some slight redness inside this one. And this one is fine. Alright, so what we're going to do today is we're going to prescribe you some antibiotics to start, and then that should hopefully clear the infection. But what I'm going to do is I'm going to have you come back in, say 8 days. We'll book another appointment and then we'll know whether the infection is going or whether it's not working, and then we might need to change the antibiotics or look at a different course of medication. Okay. And some final questions. Is the pain travelling down and affecting any other areas of the body?
No.
Okay. Just have you lift one arm up in front of you and then down, and then just bending the arm towards you and then relaxing, and then just the other side and then bending. Perfect. Okay. Just doing some final checks. Alright, if you want to pop your earrings back on, and then I'll meet you over in reception.